Hello, everybody, and welcome to the first ever podcast of All About Your Health. My name is Edwin. I will be your narrator for all shows, and I'm joined today by
Dr. Ruth Parkin-Edwin of Irie Dental Spa of the Oranges LLC and Irie Dental Associates LLC.
Okay, Doctor, wonderful having you here today on this show. So, my first question for today is, how long have you been a dentist?
Well, I've been a dentist since 1998. Started dental school 1994 September, graduated May 1998. Then I went on to specialize as a periodontist who treats the gum. That was 3 extra years of dental school, specializing in gum treatment, and graduated perio with a certificate in periodontology in 2001. So, which means I have been a periodontist for 24 years and a dentist per se since 1998, which makes that 24 plus 3, 27 years being a dentist.
Wow, doctor, that's a long tenure in dentistry. That is wonderful. So, how is the business going? Because you said that you are a part of Irie Dental LLC. So tell me, how is business going for your dental office?
Well, let's get back to some of the genesis of the dental offices. Irie Dental Associates LLC, which is located at 275 Broad Street, Bloomfield, New Jersey, 07003. Shameless plug. Phone number is 973-743-4743. That business was started May 25th, 2005. And from that calculation, we have celebrated 20 years of business at Irie Dental Associates. And on May 24th, we had a big celebration for the 20th anniversary. Then Irie Dental Spa of the Oranges was born in 2014, so that is 11 years old, and that is located at 15 Freeman Avenue in East Orange, New Jersey. Phone number 973-673-4743. 4743 is Irie.
Wow. Well, thank you for the overview of your offices. That it was wonderful. And so you said that the whole business together is 20 years old, correct?
Yes. The oldest business is 20 years old, yes.
And where does the origin of the name Irie come from? Because that doesn't sound like a regular name, like a dental office name. Usually they're named something like the city name, Family Dental, or something like that. So please tell me where Irie Dental came from.
Well, the name Irie was birthed being a loyal and dedicated Jamaican. And here goes my accent. Irie means cool in Jamaica. And when I was choosing the name, that came to me first. However, Irie is Irie in Jamaica, but for the office, IRIE stands for something. The first I is for integrity, the R is for respect, innovation, and excellence. So that's one of our motto, if you may, where we provide service with integrity, respect, innovation, and excellence. Hence the name Irie, and the Irie Dental, of course, telling what we do, and the dental spa, which we had to put a little extra on it because it's one company, but it's 2 separate entities, if you know what I mean.
Yes. What inspired you to become a dentist, and what specialty of dentistry do you practice in?
Wow, what inspired me to become a dentist? I was inspired to become a dentist. It's a childhood dream. And I always credit my stepmother, who is the mother of my brother, Patrick, in Jamaica. While I was living with them in Catherine Mount, Montego Bay, I used to go to work with my stepmother, and she was a dental nurse at the Hopewell Clinic. Having gone to work with her several times. I observed the environment as to what was going on while she was at work. One of the things I observed the most was the length of the line early morning when she arrives at work. And usually at these clinics in community and Hopewell, Hanover, there used to be dentists that come in from America as part of the Rotary program. And when they would come, there's a long list of patients awaiting to see the dentist. The lines were very long in the morning. And when the first patient goes into the room and they get the needle, we call it cocaine back then, there would be a scream or a holler. And at that first scream and holler, the line would shorten immensely. And I thought to myself, so this was about 8 years old, 9 years old. I thought to myself, I want to be a dentist to change the culture of dentistry so that it is not as scary where people or patients show up and are not comfortable showing up. And hence the reason why I dedicated most of my life to being a dentist, and I truly enjoy being a dentist, and I approach it with a empathetic approach every day that I see patients.
So, Dr. Parkin, so how do you think your impact on your patients makes them feel about the dentist?
That's a great question. And not being the person to pat myself on the back, but most of my patients, they trust me. And they're very comfortable whilst in my chair, because every mother of a certain age is my mother. Every female of a certain age is my sister. And every little child of a certain age is my child. So each patient that comes into, and every male is my brother or my uncle or my father. And so every patient that comes in my chair is treated as family. And as a result of that, there is this comfort whilst they're in my chair. Hey, you're not supposed to sleep in the dentist's office. You're supposed to be scared and looking out for what's going on. But I tell you, I have a lot of patients that fall asleep in my chair.
Okay, and just for people's knowledge, how hard was schooling for you?
I enjoy school, so schooling wasn't a problem for me, and I love what I do. I wanted to be a dentist, so as you see, I went to college, graduated in 3 years because I transferred to Uppsala College from University of the West Indies. So I did that in 3 years because I know I'd already spent one in Jamaica. So, and then I got into dental school before I graduated college, got into perio before I finished dental school. And I've always been a good student, so hard is not a word that is associated with school for me.
Okay, that is wonderful. So you're saying that school was a breeze for you and that you just, you pushed through it.
I pushed through it, and I pushed through it well.
Okay. And did you do any other work outside of, practicing dentistry as a periodontist?
As a periodontist, I'm a curious individual. So I like to have knowledge about what I do or what I say. I did extra training in orthodontics. I've done extra training with regards to dental sleep medicine.
And sorry to cut you off, but what is orthodontics?
Orthodontics is the alignment of teeth. So for braces is part of orthodontics.
And
so patients who have crowding in their mouth, spacing in their mouth, misalignment of teeth, they would see an orthodontist to get their teeth straightened and to balance their bite. So it's more than the aesthetics, it's to balance the bite so that when you chew, you are chewing on a balanced surface where all teeth are touching together and hence mashing your food so you could swallow and have good digestion.
I'd like to say thank you for coming today on our show, and we wish you wonderful success with your business, and we hope to see you again on here soon.
Thank you very much. It has been a pleasure.